Since you are really ingrained in this space, I just wanted to get your take on what we saw overnight with AstraZeneca and how quickly do you think, and what you're hearing from the medical community, and how quickly we could see a vaccine?
Well, that's the question of the day, I would say. Honestly, I don't have the answer. What I know is that it will take for sure a little time, and especially a time to even if we have a vaccine, to be able to deploy it to all the people. But sorry to tell, I don't have the right answer and the true answer to that question. I'd love to.
No problem. I think the world is waiting for that. And Anthony Fauci plays down the possibility of getting a vaccine before November. Look, good to see you this morning. We're all attempting to be epidemiologists. We're all turning into well-read people. But what I want to understand from you is what has been the biggest outcome of COVID for the laboratory world? Have productivity rates gone up? Has your capacity to deal with volume and scale changed? Just give me a sense of the change in your world in the COVID times.
Yes, I think looking at it for now, for sure, we face as of today a huge demand in volume, a huge demand in COVID-19 testing. But just remember what we've gone through over the last few months, because back, especially in France, because Biogroup is mostly in France now, during the lockdown, we first experienced a strong decrease in the revenue of Biogroup because during the lockdown, there was no testing, or at least a strong decrease in testing. But what was very crucial at this time, and what was very important, is that we needed to invest massively in new PCR testing, in new equipment, because the equipment to perform those tests is brand new. So we needed to be able to pay upfront for those equipment and to take the bold decision to massively invest whatever would be the future, because we didn't know at that time what would be the level of testing done, if this disease was to disappear during the summer, which was something said at those times, if there would be a vaccine very soon. So I think what was key for the industry is the ability to massively invest, and it's the reason why being consolidating the industry and being one of the leaders is very important. But that was a difficult decision to take at that time. And we are.
You just made
yes.
Well, I just wanted to quickly get to this acquisition you made in Belgium. You're quite tiny in France, and now you're growing. Do you see more consolidation in this space?
Yes, I think the consolidation was an evidence it was obvious in France at the beginning. Then we are representing a significant part in France. There is still room for consolidation, but at a point of time, we had the opportunity to ally with the Belgium leader, which was very important. It's a very, very interesting company, and we are very happy to do so. And the idea to consolidate is also to diversify our geography, because this industry is an industry that is also based on national regulation by the French or the Belgian state. So it's important to diversify, to share best practice, and to learn from the different system and how different the system are organized in the countries, because it's quite different.